Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a non-routine case of a patient who attended with a left-sided ear infection. And as you can see, this ear is heavily inflamed. There's edema, so there's swelling, and an accumulation of ear pus called otalgia. And they were experiencing extreme autalgia, so earache, which made the procedure really, really difficult and complicated. Now, they visited their GP, suspected this infection is due to swimmer's ear, so they got water in the ear, which then led to a bacterial infection. And they've already been prescribed some topical antibiotic spray, but their GP quite rightly recommended that they have their ears cleared prior to using the topical antibiotics, and that's because they will be far more effective. Otherwise, you've got all this pus and debris, and it's going to prevent the antibiotics from making direct contact with the surface of the skin and the bacteria causing this infection. So by clearing the ear as much as possible, it's going to give the topical antibiotics the best opportunity to work their magic. So, I mean, even at this very early stage, we can see some of the eardrum in the distance, and the patient could hear significantly better. And when you've got an infection of the ear, you generally get a lot of dead skin forming, and that's because when the ear is inflamed, it encourages the almost overproduction of skin, and this skin then, of course, dies and sheds, and it accumulates in the ear. You may have seen a bit of misting there, a bit of fogging. That's a sign of an infection. It means the ear temperature is raised. So we're now working directly on the eardrum, and you can see there's got this thick layer of pus on there. Now, guys, I'm not going to remove every little last speck. So just a spoiler alert there. It's very difficult even to get to this stage. So just be kind in some of the comments. This is a real patient. There's no anesthesia. And as I mentioned right at the beginning of the video, they're experiencing extreme otalgia pain. And so getting water in your ear, there's a myth that water in your ear is actually good for us. It washes the ear out. And a lot of patients who attend with earwax, they feel somehow that they're unhygienic and they're not doing the right things. And they say, they should wash their ears out more frequently. And it's actually the opposite. Getting water in your ear can actually lead to an ear infection, and it's not always advisable. If many of you watched the video of the ENT physician in America, who did a great talk over a duet over one of my videos, they themselves explain how water in the ear is not advisable, and they're actually discouraged from people from getting water in the ear. And the reason for that, our ears produce natural acidic oils and sweats. So sebum, which is a fatty, oily secretion, and it's composed of organic compounds such as cholesterols, alcohols, squalene, long chains of saturated and unsaturated fatty acids. So sebum is also found in our scalp. The sebaceous glands that secrete sebum are attached to the hair follicles. So the outer third of our ear canal has hair follicles in the dermis layer, so the middle layer of skin. And sebum is then transported up the root of the hair to the surface of the ear canal. And also we have an oily sweat. They're produced by modified sweat glands called apocrine glands. We also find them under our armpits and in the inner groin area. And they produce an oily sweat. It's less of a viscous solution. Sebum is quite viscous, quite thick, and cerumen, which is the name of this oily sweat, is less viscous. And this oily sweat and oily lipid secretion, as they are produced in the ear, and again, the ceruminous glands that produce the oily sweat are located on the outer third of the ear canal, and they're not necessarily connected to the hair follicle, but there's pores that reach the surface of the ear canal. So as your ears produce these natural oils and sweats, they then as they excreted on the surface of the ear canal, they spread, they disseminate across the ear canal to the eardrum and also on the eardrum. So they provide the ear canal and eardrum this protective, oily, sweaty secretion, which does several things. First of all, it's acidic in nature, and the acidity helps to repel not only insects, but it also is believed to be has antimicrobial properties. So the acidity prevents harmful bacteria and fungi from reproducing and multiplying in the ear. And this oily sweat is also hydrophobic. It therefore helps the skin that it's resting on retain its natural moisture. So in the absence of these oils and sweats, the moisture within the skin cells will rise to the surface and evaporate, causing dry skin. And it also helps to repel external water if it gets into the ear. Now, it's particularly in the case of warm water. If you get warm water in your ear, it leaches away these oils, it washes it away, which then means the skin of the ear canal is exposed. The moisture within the skin cells will rise to the surface and evaporate, and you'll get very dry skin, which can then lead to an infection. And also, if you get your ears waterlogged, so even if it's cold water, and you have water that remains in the ear, the skin cells that line the ear canal, because you don't have this hydrophobic layer anymore, the skin cells are actually hydrophilic. They absorb the water. The skin cells then swell and they burst on the membranes when there's too much fluid in there, which then breaks down the outer epidermis layer of skin, which is the protective barrier, and exposes the underlying skin, or in the case of the inner 2/3 of the ear canal, the bone directly, because other than the epidermis layer of skin, you've just got the bone, so it's extremely exposed. So that's why water is not recommended in the ear. So don't wash your ears out with water. If anything, prevent water from going in your ear. So if you're a keen swimmer, or you like getting your head under the water when you bathe, you can get some swim plugs. You can get custom made ones. You can get over the counter foam inserts or silicone inserts. There is solutions that the oily solutions, so you spray it into your ear prior to getting any water exposure. And the idea is if you don't have these natural oils or a shortage of them in your ear, it will help expel it. The video is about to end, so I can talk a lot more about water in the ear and the methods of avoiding it. So there is some granulation tissue on the posterior superior quadrant, so we have referred the patient back, and we wouldn't have known that just beyond where the suction probe is, because you always worry about a cholesteatoma when you've got, especially in this region. And that's why I'm trying to get some skin off just above it. It's quite difficult. There is a few flakes, guys, here and there. It's just difficult getting the access in the ear. It's so narrow and it was painful. But I'm really satisfied with what I've done. I've cleared the main debris. I know some won't be happy because there's a bit left. But maybe this is not the right channel for you if that's the case. But take care, guys. Keep well and speak soon. And I've got loads more videos to upload in due course. Take care. Bye.